Drug abuse in the United States today is an epidemic. Currently, there are more deaths annually from drug overdose than there are from gunshot wounds or automobile crashes.
In the last few years, prescription drug abuse has escalated, and I think you can attribute it to many things. Unfortunately, media coverage about prescription drugs, and we are unfortunately a pill-taking society, and so young people see that and think that it's okay.
Well, our son Andrew was born in 1993, and he was a very precocious and rambunctious little boy, spirited, one might say. He was a very funny child, and so then he sort of became the class clown. That's one of the things his friends loved about him, and they loved his sense of humor. He was a fun kid, and full of a lot of love.
Prescription drugs, when taken as prescribed, can be very beneficial, but when used inappropriately or illegally, they can be deadly.
Because they're prescribed by a physician, there's this idea that they're okay, that they're safe, and if I take one, it's not going to be a problem.
Long about 9th grade, we ended up catching him smoking marijuana. And then we went into 10th grade, and he got caught again. Once he started high school, things got a little tougher. Andrew was looking for acceptance, which a lot of kids do during those junior high and high school years. We were pretty shocked when we found out that he had been using prescription drugs. Because if we drug tested Andrew, we typically drug tested him for marijuana. We didn't drug test him for opiates or other things.
Prescription drug abuse can start innocently. It can start from somebody taking 1 or 2 pills appropriately, but it can lead down a path towards more dangerous drug use and other consequences.
Everybody's heard the term gateway drugs. Chemicals can lead into harder and more dangerous chemicals.
As far as we know, his ability to get Percocet just came from other kids.
As a counselor, I've had young people tell me that they deliberately are going into homes and looking through their peers' parents' medicine cabinets. They're looking for the pain pills, the Percocet, the Vicodins, the Oxy, things you're taking for getting your wisdom teeth out, things you're taking for simple surgical procedures. They're looking for the stimulants, Adderall, Ritalin, that are easily prescribed for ADHD and ADD. Those are all abused and easily abused by young people.
So I think that teenagers probably have started using more prescription drugs because of the easy access.
Since 2007, we have seen an exponential rise in prescription drug abuse across this county. And needlessly, many people have overdosed or died as a result of prescription drug abuse. Every single one of those are preventable.
So as a parent, you have to pay attention to where medications are in your house, knowing that the young people in your own home have access to them. Their friends may have access to them. It's your responsibility to pay attention to where those medications are. Keeping them locked or keeping them away from young person's access is an easy thing that you can do as a parent.
There's a lot of things that residents and parents and young people can do. First off is just to know where they are in your homes or your business. In other words, monitor the supply. Secondly, when they're, like I said, either you're done taking your medications or they're expired, you're welcome to come here, dispose of them legally, lawfully, environmentally safe, and then law enforcement will take it from there. Well, this is one of our countywide medicine disposal boxes. It is locked, it's monitored by video surveillance. Residents from the county feel free to come in and dispose of their medications here free of charge.
So a lot of parents will ask me, why young people start using chemicals, and I really believe that most young people start using for a variety of reasons, including curiosity, their peers are using, they hear about it, they want to fit in. I think those are reasons kids begin to use, but I really firmly believe that young people continue using and or abusing for other reasons. And I think then it starts to move into coping skills, coping with what may be happening in their home, happening in their personal life. They may have a mental health diagnosis. The two of them go hand in hand.
I want it to be known to parents that it's not just this group of kids that are doing it. This group of kids includes 4.0 students, great athletes, heading to college. They're on, the yearbook staff. This substance use knows no boundaries.
Prescription drug abuse is extremely dangerous, in some cases even deadly. The problem is that people get hooked on prescription drugs, mainly the opiate-based painkillers, and that leads to something else like heroin abuse or heroin overdose, which is extremely deadly.
Then that fateful night came in March when about 4 in the morning I woke up and I noticed that there was a text message from Andrew, and he had said, Mom, would you please do me a favor and throw my clothes in the dryer when you get up in the morning, please and thank you. It just so happened that Bill decided, he had planned this beforehand, to take Tuesday off, so he was home. And at about 11:30, I went downstairs and the alarm clock was going off. So I opened the door and I said, Andrew, Andrew. I yelled at him a couple times, nothing. So I went in and I shook him, and I shook him again, and nothing. And so then I felt his face, and it felt cold. And I felt it again, and it felt cold. And then I ran upstairs and I got Bill and I said, you need to come down, Andrew's unresponsive. And Bill came flying down the stairs, and we turned him over, and he'd been gone for a while. I called 911, and Bill got Andrew on the floor and tried to do CPR, even though he knew that Andrew was gone. And the rest of the day is kind of a blur, but we came to find out later that Andrew had died from a heroin overdose. Unintentional, and he had snorted it. I find out later from interviewing some of his friends that he had started using Percocet again, long about in January, or oxycodone, whatever he could get, and he couldn't get any that night. But somebody told him that they could get him heroin. He did it, and we're not quite sure where, but it cost him his life. And he didn't intend to end his life, but that's what happened. We were always so hopeful about what he could have become, because I think that if he could have beaten this prescription drug use that then led to using heroin one time, that he could have done good things. He always told me that he wanted to come back and maybe go to school and go into some field that would help kids that struggled like he did.